This combination medication helps relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin thins and loosens mucus in the airways, clearing congestion and making breathing easier. Dextromethorphan reduces the urge to cough by acting on a part of the brain called the cough center. If you are self-treating with this medication, be sure to read the package instructions carefully before you start using it. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Follow all dosage directions carefully to decrease the risk for serious side effects. Do not use this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or using saline nose drops or spray. When taking antitussive DM, it's important to follow your doctor's instructions. Whether you take it with or without food, make sure to drink plenty of fluids to help break up mucus and clear congestion. The dosage will depend on your age, medical condition, and how you respond to treatment. Never exceed the recommended dose. If you're using the liquid form, use a special measuring device to ensure you're taking the correct amount. If you're using the powder packet, swallow it whole without chewing, and if you're taking the capsule form, also swallow it whole. It's important to use this medication properly to prevent serious harm. If your cough returns or is accompanied by a severe headache, fever, sore throat, rash, or lasts longer than 7 days, contact your doctor as these could be signs of a serious medical problem. Some common side effects of antitussive DM include dizziness, drowsiness, nausea, and vomiting. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed, it's important to contact your doctor or pharmacist. As for the optimal timing, it's best to follow your doctor's guidance on when to take this medication. The daily dosage will also be determined by your doctor based on your individual needs. Before taking antitussive DM, make sure to tell your doctor or pharmacist if you are allergic to Guaifenesin or Dextromethorphan, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may make you feel dizzy or drowsy, and consuming alcohol or marijuana can intensify these effects. It's advised not to drive, use machinery, or do anything that requires alertness until you can do it safely. It's also important to limit alcoholic beverages and talk to your doctor if you are using marijuana. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid sugar or alcohol, caution is advised when using the liquid forms of this medication. It's best to ask your doctor or pharmacist about using this product safely. The liquid forms and powder packets of this medication may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this medication safely. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if Guaifenesin or Dextromethorphan passes into breast milk, so it's best to consult your doctor before breastfeeding. When taking antitussive DM, it's important to be aware of potential interactions with other medications. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors, such as isocarboxazid, metaxalone, and phenelzyme, while using antitussive DM, as it may cause a serious and possibly fatal drug interaction. It's important to consult your doctor about when to start or stop taking this medication if you are also taking MAO inhibitors. Additionally, be cautious of the product rolapitant, as it may interact with antitussive DM. Always check the labels of your medications to ensure you are not taking more than one product containing guaifenesin or dextromethorphan. It's important to note that guaifenesin, a component of antitussive DM, may interfere with certain lab tests, potentially causing false test results. Make sure to inform lab personnel and all your doctors that you are using this medication. When taking antitussive DM, it is recommended to follow the prescribed dosage and timing as directed by your doctor. If someone has taken too much antitussive DM and has serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If your doctor has prescribed antitussive DM, it is important not to share this medication with others. It is important to keep all medical and lab appointments to monitor the effects of the medication on your body. If you forget to take a dose of antitussive DM, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing antitussive DM, it's best to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom or freezing the liquid form. Different brands may have different storage requirements, so it's important to check the product package or ask your pharmacist for instructions. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for proper disposal when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.